Kako zelo nepogrešljivi ste medicinske sestre, babice in zdravstveni tehniki, vam sporoča tudi Fran McConville iz Svetovne zdravstvene organizacije. Na povsem konkretnih podatkih in številkah bo pojasnila, kako pomembno je kakovostno babištvo in kakšen vpliv na življenje ima. To je tisto, kar lahko prepreči vsakoletne milijonske smrti novorojenčkov in žensk pri porodu, pojasnjuje.
So hello to everyone in Slovenia and the Nursing and Midwifery Associations. And it's so wonderful to be with you on these celebrations of the International Nurses Day. And I'm Fran McConville, bringing greetings from WHO headquarters. And we want to send you all our love and best wishes on this really exciting day to celebrate and thank all of you Slovenian midwives for everything that you do every day in the most difficult of circumstances. And we want you to know how appreciated you are. You are invaluable to women, newborns, their families, to communities, and to us at WHO. We cannot possibly achieve the global targets around universal health coverage, respectful care, and all the other issues without you. So huge thanks, and I hope you're enjoying the celebrations. So I'm here today to talk to you with help from Billy Hunter, Professor Billy Hunter at the WHO Collaborator Centre at the University of Cardiff. And I want to talk to you about the potential impact of midwives on lives saved and what this means for the future of midwifery. And we really are in very exciting times. So, first of all, a wonderful paper came out in the Lancet Global Health, led by Andrea Nove, Caroline Homer, in December of 2020, and it's modeled estimates. So to be very clear, this isn't evidence, but what we did was identify 31 midwife-delivered interventions that are essential, that directly affect mortality or nutritional status, are essential to the delivery of the global strategy for women, children's and adolescents' health, and can be entirely delivered by a midwife according to those all-important International Confederation of Midwife standards. We used a tool called the LIST tool, the Lives Saved tool, to estimate maternal deaths, newborn deaths, and importantly, stillbirths, which is still far too hidden. They are huge, the number of stillbirths. And we looked to see what would happen up until 2035 in 88 countries that were either low income or middle income. And we repeated this in 4 scenarios, 10% scale up, 25% scale up over 5 years. Everybody gets care, which is the ideal. 95% get care by 2035, and then of course attrition. And many partners, as you can see at the bottom, took part in this. So what did we find? We found that if 95% of women get this universal coverage by midwife-delivered interventions, we could save 4.3 million lives a year by 2035. We could avert, therefore, 67% of maternal deaths, 64% of newborn deaths, 65% of stillbirths. Now, even if we only go for a modest 10% increase, which is all that will happen in countries that don't have midwifery really, we could still avert 22% of maternal, 23% of newborn, 14% of stillbirth. That's huge. So there's lots that we need to do. So this study adds confidence to the previous data that came out in the Lancet series of midwifery in 2014, and it focused specifically on midwife-delivered interventions, and those interventions have the greatest impact, and it also has a very interesting section on barriers that are preventing us from moving forward, and it calls for us to take action on these. So that paper hugely added to the State of the World's Midwifery report, and you'll all know by now it was launched on May the 5th, and you'll have found it on the UNFPA website, the WHO website, or the International Confederation of Midwives. So along with the staggering figure that midwives can cover when they're educated, regulated, international standards, working in a health system supported by a good environment, they can cover almost 90% of all the care, sexual, reproductive, maternal, newborn and adolescent. But the report says we only have 10% of the midwives we need. We have to change that for the sake of women and newborns and their families. We cannot leave it as it is. So what it recommends is investment in 4 critical areas. So the first is around health workforce planning, management, working environment. We must optimize midwives' autonomy and their scope of practice. We cannot have midwives who really can't practice to the full scope. They're being told not to. We've really got to change that and provide an enabling work environment where they're allowed to do that and supported to do that and guided to do that. We need really high quality education and training. And I'm going to come back to that point. It is so critical, with educators and trainers who know what they're doing, and education training institutes that are fit for purpose. A staggering 30, 40, 50% in some countries of education institutes do not even have a functioning toilet or water. How can we get the basics of sanitation and hygiene right to prevent sepsis and all the other problems if we don't even think that midwives are valued enough to have functioning water and sanitation in their facilities? We need to invest in midwife-led improvements to service delivery. These are improvements really led by midwives, for women and newborns, with the team, with the obstetricians, the neonatologists, etc. But midwives know what women need, and they need to lead those services. So we need midwife-led models of care, and we need expanded roles for midwives so that they can really care for women. Even when they have that cesarean section, they stay with that woman, come back to her, care for her postnatally, and keep that care going. And of course, for all of this, I'm so delighted to say that really, I think for the first time, we have all the evidence to show that we've got to move to midwifery leadership and governance. And we know often in ministries of health or in other areas, it's not really midwives that are leading on these programs, but now it's time. We know that midwives know what it is that women need and their babies and their families. So we need senior midwife positions, and we need to involve midwives in policy making. So often there's no midwife anywhere when policy is being made about midwives and about midwifery. So now is the time to change that. So I want to talk briefly about education. It is absolutely critical, and for WHO, we've really focused on this. And you can see that in 2019, member states at the World Health Assembly launched this report about strengthening quality midwifery education for universal health coverage in 2030. So you can see UNFPA, UNICEF, and the International Confederation of Midwives came together with WHO. So we have really good collaboration. We're all committed together to working together to make this happen everywhere. So we're focusing on midwifery education because we still have an estimated 810 women die every day in childbirth globally, 2.4 million newborn deaths a year, a stillbirth every 16 seconds, and a staggering almost 20% of women don't even get a care provider with them during birth. I mean, that's tragic, and many, many deaths are taking place at that time. Not so long ago, we were encouraging everyone to go to a facility. The latest evidence is showing those facilities in many countries of such poor quality that women and babies are just dying in them. It's not functioning and it's not working. So we have to change that quality. So that's the big focus. And we find in educator surveys that WHO carried out and ICM has carried out, many, many educators don't even have the basic knowledge, skills, and competencies and behaviours, and they don't have the teaching materials, and they just don't have anything basic to enable them to teach. That's got to change. So just to highlight that midwifery education is not just about the birth. That's the dramatic part, the fun bit, the interesting bit. Often people just think midwives need to be in that labour room doing births. Midwifery scans takes place over the whole continuity of care, right the way through antenatal, postpartum, family planning. And if you put midwifery at the centre, the evidence shows that it helps women and newborns and their families survive, thrive, and transform communities. It's a huge thing that midwifery can achieve. Mortality is reduced. Harm to women and her newborn is reduced. There's a lot of harm to women and newborns happening during childbirth particularly. There are improved psychosocial outcomes. Interventions altogether are reduced with better outcome often, and improved public health such as breastfeeding, that first and most important public health intervention, and improve health service outcome. The whole services improve when you get this midwifery model. So I won't go into detail, but we get reduced mortality, we get reduced serious mortality, reduced hypothermia, infections, increased satisfaction with childbirth, so important for mother-baby interaction, reduced anxiety, newborn crying, depression, increased spontaneous vaginal birth, less intervention and augmentation and episiotomies, things that just need to stop, and for which there is no evidence, by the way, of episiotomy, and increased breastfeeding initiation, birth spacing, immunization, decreased smoking, all sorts of good things happen. And importantly, midwives who know what they're doing and are really experienced, they will refer more women, not less. And I think often there's that problem that senior staff will think midwives will want to do it all themselves. We don't. We want to make sure the woman has the best outcome. So we will identify problems earlier, quicker, and make sure they get the right help. That's what the evidence says. So please remember all of these things that midwifery does. We must remember that it's not just about the curriculum and teaching, it's about regulation, integration, and interprofessional teams, working with those doctors, the nurses, the community health workers, and making sure that all midwives are licensed, regulated, fully integrated into the health system, not left to stand alone, and they work in these teams. That every woman and midwife, woman and newborn, is cared for by a midwife educated to these international standards. And it's wonderful that we now have this global consensus, you can see in this report, that the title midwife should only be used for providers who are educated to those international standards. We have not had that consensus before, so it's great. We must, as Somi says, strengthen leadership and coordination. So it's extraordinary, really, that after all this time, and we know in Slovenia, you've had a real strong history of midwives for a very long time, but it's so cost effective, but we're so lacking in investment in midwifery and in particular the education that's needed, compared, for example, to medical education. So we came up with a 7-step action plan, and I'll just briefly take you through the steps. But the message is that you can't just focus on a curricula. You really need to do all the steps. And it took 3 years of policy dialogue. Many countries came together. We spoke to midwives and doctors and academics and researchers and social scientists. This is what we came up with. The first step, no surprises, apart from putting women and newborns at the centre, not the midwife or the doctor or the facility. Strengthen that leadership, midwifery leadership and midwife-led policy. All countries need to re-look at what they're doing. Then get the data and evidence around midwifery. We've got most of the data and evidence we need around maternal deaths, for example. But what about midwifery? What do you know about midwifery in your country? What do we need? Is it appropriate? Is it doing the right thing? Then build that all-important public engagement and advocacy with women, with parliamentarians, with the professional associations, the doctors, with all sorts of people to make sure that women and others are demanding quality midwifery care. Then prepare your educational institutes, practice setting, and the very important clinical mentors to really make sure that quality of care is good in the facilities or in the home. Strengthen faculty standards and curricula. That's what we've all been focusing on, but we've got to do those 4 steps before we get to that. And then after you've got your standards curricula and your faculty, educate. And then of course, monitor, evaluate, review, and adjust. And this is a cycle. So you will be doing these things all the time, but we really recommend that you go back and just look and keep looking every year, keep updating where you are on all these things. So really pleased to see, as you know, that standards was one of the steps there. And I heard from Anita, it's fantastic that Slovenia now has your own professional activities and competencies for midwives. So huge congratulations. That is a really huge piece of work, and it's going to make a big difference. And I'm very pleased to hear that it's based on those ICM competencies, which you can see on the slide. And I've just added what the UK midwives have done, because they have really improved their standards and their proficiencies over the last few years. And they launched this in the Year of the Nurse Midwife 2020 last year. And they're superb. So you can always go back as part of Europe and work together. But I'm sure yours, I'm just so pleased that you've got yours. It's going to make a huge difference. So I just want to suggest another tool, which you may or may not have come across, which is called the MATE tool. The Midwifery Assessment Tool for Education, developed under the leadership of Professor Billy Hunter at the Cardiff University in Wales, and field tested in several countries in Europe. What I like about it is it's a self-assessment tool, and it lets midwives ask the questions they need to know about, which is, where are we now? Where do we want to go in midwifery? Now, every country needs that. It doesn't matter which country in Europe or globally. We are changing all the time. And with this SOMI report, we need to look at those recommendations and investments and think, so what do we need to do now? what do you need to do to get there, to be able to implement those recommendations? And it also provides some super links to some really great resources. And this belongs to midwives, to leaders in the countries. It's not somebody else's. And you'll find this on the WHO Euro website. And so I really encourage you to go to that made tool. Here you can see the questions that are asked. So for example, where are you? Do you have midwives to the standards of the ICM in your countries? Where do you want to go? Is that where you are now? Do you want to go further, or are you not there yet? Some countries still have traditional birth attendants and perhaps a nurse midwife who's maybe just had a few weeks of midwifery training. They're going to want to make a step further. It's very difficult to go the whole way. All of a sudden, it's taken many countries decades, if not centuries, to get the midwives that we need. And then the useful resources. So you can see that. And please, as I said, feel free to use it. So I just want to provide a little bit of the evidence around this huge recommendation in the SOMI report around midwife-led continuity of care models, and let you know that it's in the WHO recommendations on antenatal care for a positive pregnancy experience. This is a fantastic document. I really urge you to look at it. Similarly, it's in the intrapartum care for a positive childbirth experience. And this is where you'll find all the recommendations around episiotomy, mobility, having a companion at birth. Everything is in here, the latest evidence-based guidelines, and it is a superb way to check that you're doing what the latest evidence says in midwifery. It's a really useful guide. And then, of course, this postnatal care guideline as well. So please do use these documents. They're all free, all available on the website. And what it says under the health systems intervention is that midwife-led continuity of care models in which a known midwife or a small group of known midwives supports a woman throughout antenatal, intrapartum, postnatal continuum, and are recommended for pregnant women in settings with well-functioning midwifery programs. Now, that's not all countries. I think Slovenia could really look at this and see how much of a midwife-led continuity of care model you have, and just look at whether or not you can start to address that as you move forward over the next few years. And just to highlight the evidence on this that's coming from high-income countries only, but I'm hearing from Professor James Sandel at King's College London. We're just getting the same evidence over and over again. Something is happening. We don't know what, but when you have this midwife-led continuity of care model, for example, women are 24% less likely to experience a preterm birth. If that was a vaccine, we would be vaccinating all women to stop this preterm birth problem, because the problems that follow, as you all know, are so hard for the mother, the family, and of course for that baby and the care that they need. I like the one that you can see next to that, which says they're 16% less likely to have an episiotomy. That's really important. And then if you look at women's experience, just much better altogether. They feel in control. They have a choice of pain relief. They know where they're going to have birth. They choose it. So when women are satisfied and feel good about their birth, it changes their relationship with their baby and their birth and their bodies for the good and for the future. So this is seriously important. Very pleased to say that in the 7-step action plan we have developed, not yet published, a monitoring framework. You can see the 7 steps on the left, that we've looked at longer term outcomes, and we've got these new measures. And these have been developed with International Confederation of Midwives, UNICEF, UNFPA, and WHO. So for the first time globally, we have a monitoring framework for improving midwifery education to be adapted, for example, to Slovenia. This is really important when you design programs, when you're using your government's money to spend on midwifery education. You need to demonstrate what you've done, what you've achieved. You need to be able to measure it and cost it. So at last, we have this tool. It goes into much more detail than this, and we will soon be sharing that in the updated framework for action with the updated 7 steps. So moving towards the future, it's good news. And I'm really pleased to say that WHO Euro will be leading on a roadmap for nursing and midwifery. The objectives are to support European member states to continue the great work you're doing on strengthening the workforce. It's going to guide the implementation of the policy priorities that you have fed into in the strategic directions for nursing and midwifery, which will be launched during the World Health Assembly, and there will be a resolution to member states whether or not to accept that or change the language. That's going to be interesting. And it will focus on education, jobs, service delivery and leadership which are the big issues in the strategic directions. The audience for that is you, key nursing and midwifery stakeholders, policy makers, decision makers, professional associations, and of course research institutions. And we have a content which will be taking into account your lessons learned from COVID-19. It will include new regional data from a survey carried out in the context of the previous strategic directions. And of course, your best practice examples, your milestones will guide the implementation of this. So I really hope that you'll get engaged. And where are we now on this? Many of you will know that the first biennial meeting with the nursing and midwifery representatives across Europe took place in April. The meeting report from that will come out very soon. It's going to identify the specific issues for Europe. They'll be very different to Afro or the Western Pacific region, for example. And then WHO Euro will lead this roadmap with WHO collaborating centres and other key stakeholders. So it's going to be a big partnership which will have a regional steering committee and a regional advisory group on midwifery. And the consultations will go on until the end of the third quarter of this year. And we hope that we'll have that final roadmap for Europe by the end of the fourth quarter. So this shows that Europe is investing in that all-important governance and leadership. And you'll be setting a really wonderful global example to have a roadmap. And I'm sure other regions are going to want to follow what your inputs are in Slovenia and across Europe to really having a roadmap for nursing and midwifery. It's going to be fantastic. So just to say at the end now, what is it we have to look forward to globally? And I have to say it's really exciting. We have an awful lot to look forward to. I think midwifery is in such a good place after so many decades, centuries of struggle. I feel that we're really turning the corner and many people feel very optimistic. We've got the State of the World's Midwifery Report, amazing. We have the ICM Triennial Congress in June, and I think that's really going to focus on these issues coming out of the SOMI and leadership and all the rest of it. Some great things happening there. Please register if you have not. I'm really pleased to say that my department is leading on a new global maternal health strategy. It's going to be very different. And it won't just focus on the emergency obstetric care. It will bring in so many issues around societies and communities and women's needs, but it will have a huge focus on midwifery right the way through. So that's a really good change that we can look forward to. And I like to say, I kind of predict, I'm sure that we're going to have a lot of research now focused on models of care, midwife-led continuity of care, networks of care. That's all feeding into this new maternal health strategy. And I can promise you the global interest in moving forward on research, not only on what drugs do you use for preeclampsia, but what models, how are we delivering this care? How do we get the best for women, newborns and their families? And of course, we know that midwifery is absolutely essential to that and this continuity of care model. So leadership right the way through and partnerships with yourselves and many others, the UN agencies, NGOs, of course, governments, the professional associations like yourselves and women. So thank you so much for listening. And I just want to congratulate you and thank you again for all that you do for women, newborns and their families. I'm a nurse as well as a midwife, and I'm very proud of that. So to all the nurses as well as the midwives, I hope you have a wonderful day. Celebrate, enjoy, take time to appreciate what you do and how much it matters to so many people. Sending you lots of love and congratulations on this day. Do take care. Times are hard, and I hope that things go really well, and I look forward to this European roadmap. Thank you so much. Goodbye.